Ending a video session is just as important as starting, because you want to end on a good note. You got to make it so comfortable that the patient will come back to you again and again. So what kind of etiquette can I share with you? Well, first of all, you should make sure that you've answered all the questions that the patient asked, or at least most of them, within the allotted time, of course. You just can't keep on blabbing, of course. So it's good to have an idea of how to end the session. Make sure you've answered all the questions, and if they ask for a prescription, of course, remember my position, it's better if you don't prescribe. If you need to mention a drug name or a intervention of some sort, what you can do is to go to the chat box and just type in a generic term. Or you can just say, you can ask your local provider, what do they think of this type of drug? Will it affect your management? Because like I said, sending prescriptions in digital health is a little bit complex, and I want to make your life less complex. So let me repeat the last part. If you have to end the session with a prescription, maybe it's better to just type in the generic name of that drug which you think will help, and you can just tell your patient that you should probably confirm with your local provider. It's good for everybody. It's less of a legal hassle. Thirdly, patient's going to ask, all right, doc, I've heard what you want to say. How do I follow up with you? How do I reach out to you again? Some may suggest that you can share your mobile number or email address. Personally, I don't recommend that because, again, I want to respect your freedom. And whichever country you're in, of course, there's a huge time zone difference. You don't want people calling you at weird times. So the best thing you can do, if the patient is really happy and they're willing to see you again, you could say, how about next week, same time? Right? That makes sense. I mean, imagine if it's 3 p.m. somewhere in UK and the patient is somewhere in the Emirates, in Dubai. So that's like 6 p.m., I think, 7 p.m., which is not bad. So you can just tell them, hey, how about you catch up with me next week and I'll try to be online at the same time. That works out for everybody. You could be a few minutes early or late, it doesn't matter. At least that person is waiting for you, and vice versa. So again, I think the best way to end the session is with a smile. Be happy, be courteous. See, people know that telemedicine is not curative. It's not going to cure anything, to be honest. But what it can do is to guide them towards an informed decision. But that's what they want. They want you to teach them how to make practical decisions that can positively affect their lifestyles and their health outcomes. And I think if you can end with a high note, make the people happy on the other end, you've done your job. And people thank you for that. So that's it from my end. If you have any suggestions, please reach out to me and tell me what's the best way to end a call, and I'll be sure to incorporate it. So take care, and let me end this call.